Welcome to Be the Category of One. I'm Jenn Brown. Each week, we explore growth, mindset, and leadership because standing apart starts from the inside out. Hi.
Hello.
Hi.
Welcome to the podcast.
Thank you for having us.
Thank you.
I'm happy to have you. When I started thinking about who I wanted to talk about on the podcast or talk with, I immediately went to the two of you because I think it's so incredible that you both are practicing in the same practice, husband and wife, and you're making it work. And the patients comment about it, the staff comments about it. I was always, you get nervous, you don't know how that's going to work out. Like if you had Cliff and I in a practice, day in and day out, same overlapping shifts, I'm not sure we'd have such success, but it really works so nicely for you guys, and I just love it. Just to go back, I was thinking on my drive here how we met. I met you first through a recruiter, and I know we talked a lot about the opportunity, and then you decided to join. Mm-hmm. And then, of course, you mentioned your wife. Well, you mentioned your wife, I think, when we were still talking. Mm-hmm. In the back of my head, I was like, could this possibly work? And then you wanted to join together. I thought it was great. And what has been really nice to watch, and we can talk about it, I'd love to start with it, is how you have a young family, mm-hmm. and you're growing in that family space, and it's nice that you've been doing it with the practice. So, I think you went away for was it a second honeymoon or an anniversary?
That was are you talking about a couple of years ago in Japan?
It feels like it was just yesterday.
I think it was 2 years ago.
2 years ago.
That was our delayed honeymoon because when we got married, it was basically COVID time, and then Japan wasn't allowing visitors in. So a couple years ago, that's when we decided to take our delayed honeymoon.
So let's go back. So tell me how you guys met. Tell me, and I'm sure there's a mix of dental in it. So let's mix let's mix it all up and tell the story.
Do you want me to?
Sure.
Yeah. So we actually met literally the first day of dental school.
And where'd you go to dental school for people who don't know?
I was in Glendale, Arizona. The school was Midwestern University.
Okay.
So the first day, it was in a lecture hall, looking to find seats, and then we randomly ended up sitting next to each other. So from the first day, we
became friends.
Randoms.
Yeah. Well, I wouldn't say we became friends.
Yeah.
So wait, I just want to get context because I've not spoken to many dentists who went to that school.
Right.
Large school, so it was a lecture hall, a lot of kids, big class.
Yeah.
Yes, there was. What was there?
I don't remember, but it was a big lecture hall.
Yeah.
And where did the students come from?
All over.
You were from California, correct?
Mm-hmm. From California.
And you grew up in
Long Island.
Merrick?
Yep.
Okay.
Merrick.
Yeah, so I think there were about maybe 150, 200 classmates, but...
And graduated with that?
Yeah.
Okay.
Yes, maybe a little bit less, but...
Maybe a little, maybe like a few of them jump ship.
Yeah, but I remember one of the early lectures, Chelsea would always bring in these smoothies in a mason jar. This is like when we weren't even friends yet.
This is someone who grew up in Merrick.
Yeah. We weren't even friends yet, but we would kind of still sit in the same row for lectures, and every day she would bring in these giant mason jars of smoothies that she would make. And then
I barely could get to class on time. If you had to include making a smoothie before class, it would never happen for me. But go ahead.
Yeah.
I love it.
It was like a thing for her to bring in a smoothie every day. And then there was that one day where I don't even think I saw it happen, but I heard a commotion and I looked over at her, and then the smoothie all over the carpet in the lecture hall. She like spilled the whole thing.
It was like bright pink too. It was everywhere.
Oh, nice.
Yeah.
A blueberry or whatever.
Yeah.
That's when I fell for her.
You did?
No.
No, we started studying together. It was around anatomy. You asked if we could study together, and then we spent like every day together.
Yeah.
We became best friends.
Really?
Mm-hmm.
Okay. So when did something happen?
It was
Probably like the second year of dental school.
Wow.
second
Yeah.
year.
That's
But we
really
spent a lot of
nice.
time together. Yeah.
And you had a nice friend group together
Mhm.
and all that.
Yeah.
Nice.
Yeah.
Okay, so then you graduate.
Mm-hmm.
So we graduated. We moved to Austin.
Okay.
Well, so the backstory to Austin is, right, because I'm originally from Los Angeles,
Right.
West Coast. She's from Long Island, East Coast. And my family's still there. Her family's still there. All of our friends and everything, they're all in separate, coasts. So we were trying to decide we can't pick both, right? So at the time when we graduated dental school, we had to choose between one of two board exams, right? One, it depends on which one you choose is where you can practice, right? So
Okay.
the one that we chose, the 8X exam to take, is the one that would cover a wider range of states that we can practice in because we didn't really know exactly where we wanted to be yet. So we took that one, but that also locked us out of California.
What do you mean locked you out?
So if you take that exam, then you aren't able to be licensed in California.
Ever?
I think now you can, but back then you could not. If you wanted
Makes
to
no
work in
sense.
California back then, you would have to take that separate board exam all over again.
It's not just one board exam. Like
Yeah.
every state chooses. So the exam we chose, like you couldn't practice in like one of the Dakotas
Right.
and like another
Interesting.
state.
Yeah. So
that we were never
there was the
really told.
8X exam, which is what we took, and then the Western Regional Board exam, which is what California would have accepted.
Interesting.
So we were trying to find a place in between East and West Coast, and Texas was pretty much right in the middle, and was hearing a lot of great things about it because it was such a booming city. Austin.
My cousin's one of my cousin's daughters lives there. They're raising 20s there, young family, and Facebook stalk. I mean, she has a whole life, and they're all young professionals, go-getters,
Right.
beautiful, beautiful. And we've had a web vendor that was from Austin. Their whole company was out of there. Young people,
A
yeah.
consultant too, right? That we,
Well, yeah. So Max is from McKinney.
mhm.
So I don't believe that's by Austin. I think that's more.
Who
Angela.
was it? Yeah.
Oh,
Angela.
Angela. Yes.
Yeah,
Oh,
Angela.
okay.
Yeah.
I'm sorry. I went.
She's in the suburb of Austin.
Yes. Yes.
Yeah,
Sorry,
but-
I went back to Max. Max been with us for 40 years. So.
Yeah, so we ended up in Austin for, what was it, like 3.5 years or so. I really enjoyed my time there. Yeah.
Now
it was a great place.
It was a corporate practice.
In the very beginning, right? So my first job out of dental school was at a corporate office.
In
I was
Austin.
In Austin. So I was there for about a year. Chelsea was at a basically the same company, but a different office, a different location.
Okay.
We had two totally different experiences in the
Right.
same corporation in different practices.
Did they still have the? I'm assuming they didn't open the corporate office. They bought a dentist office. No,
Yes. Right?
No, they
they
This-
opened it.
they opened
corporate
it.
opened it.
corporate opened it. But
Norm- 'cause-
he had a owner doctor at his office. I did not. There was
okay.
no one on site. So
Okay.
as a new graduate with no
No.
mentorship there, it was
Interesting.
not an experience that I wanted.
I didn't realize that about your first. I know we talked about your 1st experience, but I didn't realize it was like that. And you had an owner doctor.
Right.
He was probably in his late 60s or so.
No, it was a she, and she was in her probably like early 40s.
Oh,
Yeah, she was great. Yeah,
okay. So she's going to stay. It wasn't an end of
right.
the road deal.
Yeah,
Okay,
so it's
gotcha.
her practice. But she was very. It is crazy how different our experiences were, right? Because she was very supportive. She would offer me insights and advice, but would really let me do my own thing and find my own lane. She would never really try to, tell me how to treatment plan, how to diagnose, how to treat certain situations. But she was always there if I needed some sort of guidance. So
What was the
very beneficial.
patient base like?
At this practice or in Austin in general?
Just in general, between the two of you, was it similar or no?
In the two places that I worked in Austin, because I was at the corporate office for about a year, that was, I'd say, good. It was kind of in the suburbs, right?
Because here's my thing where I'm going with that question. I probably should have clarified it. What I'm finding in dentistry is where a lot of people who are in dentistry, we know how important keeping your mouth healthy is. I still believe that that's probably 10 to 20% of the country. I think that that's very, very rare. And the more you get out of an LA area center or New York, I think that that number really holds true. It's probably 80-20. I think that most people grow up in a space that it's not part of their health regimen. You know, when you're clustering your appointments, whatever time of the year it is, I
Right.
don't think they add that in.
Yeah.
So, I don't think hygiene, anything, is part of a health regimen. So, is it like that? But Austin, to me, is such a young,
But Austin's very small, right? So it's very densely populated, but the space itself is very small in terms of mileage, right? So there's little pockets you can get a really big variety of patients, and their dental IQ is very different too, right? So the second job that I had after the corporate office was a private practice, but I feel like I was pretty spoiled with that because it was in a suburb, a little bit north of Austin. You know, all my patient base was basically people working in tech. You know, they're managers, directors of these tech companies. So they're all, you know, taking things seriously, and they've had already been taking pretty good care of their dental health. So their dental intelligence, you know, things that I would discuss with them, things that I would recommend with them, they all understood it.
understood
wasn't
and
really
probably
much-
went ahead with it. Yeah.
Right. Yeah.
Right.
So they're already
Was
very
that the
educated.
office that was very technology based, where you,
It was.
Yeah.
Yeah. Yeah. Yeah.
and your experience?
I worked in downtown Austin, and we actually marketed to a Hispanic community. So
Okay.
my patient base was a little different. It was a lot of full mouth extractions, implant retained dentures. But there was also a lot of young professionals that just moved from New York, from LA, like right after COVID. So they were also,
Oh, right. You gotta.
I had a
yeah,
lot of
we
that
were
too.
we were
Yeah.
right there.
Were you
Like, I-
during COVID at all,
Yeah.
or no?
Yeah,
Did they
I
shut you
had-
down?
Yeah.
Yeah.
I had just left my corporate office and I started at a private practice in March. And the day I started, they pulled me into the room and they were like, there's something called COVID going on, and we're
Oh,
going
I-
to have to let you go.
Yeah, you're giving me PTSD.
Yeah. And I was like, okay. So I was off for 3 months. I actually applied to work at a supermarket to stock the shelves at night because I was so bored and I had no idea what life looked like.
Yeah.
Yeah, no, that was
It
a
was
very scary
scary.
time. And
Yeah.
you stayed working, or
Right. We never shut down.
you know? Yeah, we didn't
Yeah.
shut down either.
Like,
I mean,
it was-
we had to, furlough half the staff, but
Right, but it was more like the goal. I think the directive that dental practices that stayed open, it was to intake urgent patients to keep them out of the hospitals. So
yeah, I mean that was our goal too. The issue that we constantly faced was, I don't know what your PPE situation was.
it was full on. Yeah.
Yeah.
So I had the
No, but like,
hairnet.
no
No, were
difficulty
you
getting
yeah.
Oh yeah, that was very tough as well.
Yeah.
Yeah.
I mean, I spent 2 weeks securing a deal for masks. We got the masks, and we created a safety committee to get people involved so they would feel comfortable. So
Right.
they were involved in all the things that we were going to implement upon a full reopen.
Right.
And I get these masks, and I'm like, I scored. It was like getting a Cabbage Patch doll when I was a kid. And, I get a call from Yasmin, and she's like, they're fake. I'm like, how do you know?
Oh,
She's
we
like,
had
I
that
poured
too.
water. I'm like, oh,
Yeah.
God, you can't.
Yeah.
Yep.
And that was our biggest issue, is that we were treating a lot. I went down to just the partners, so Cliff, Harold, and Steve. And the issue was I struggled with getting what they needed to, serve without risk. And it had gotten to the point where I had called all the dental societies, and they really had nothing for me.
Right.
So I had called Dave German, and I said, what are you guys doing? And he's like, well, the oral surgery groups they must have a very good lobby group. They were getting actual deliveries from the state agencies. So he said, I'll give you, what do you need? I said, honestly, Cliff's been wearing the same mask for like 3 days. I'll take masks. So Dave came in and gave, us a ton of stuff. But yeah, it was crazy. And the patients that, I don't know what your patient group looked like, but it was, Cliff just had so many crazy situations like he never even saw. So, and I think here, I don't know if it was back where you were, but I think people also didn't want to go to the hospital. Like the consumer that might have gone to the hospital for a dental emergency were seeking out private care because they didn't want to go into the hospitals. It was like the Wild West. We got paid on Medicaid claims we never did before because we could file as an emergency situation. But
Yeah,
it
there
was
really
just
was no standard of how to operate, right? 'Cause you would go.
no
Yeah.
one was available to say anything.
Yeah.
The attorneys, my HR attorney had no idea how to guide, and it was hard because it was a real threat, right? And people, when you get into, and we'll talk more about this, but anxieties and treating like a highly anxious patient. Well, not only did I have that, but I had a staff that was like losing it. And then Cliff, who he's like, I got through the AIDS epidemic. This is like, to Cliff, it was nothing. Meanwhile, the man never got it. He did the Johnson & Johnson one shot, which he couldn't even register. I think at that time, the practice administrator had to register him, tell him where to go. It was like nothing affected him. It was fun. It was like, this is not a big deal.
Yeah.
Meanwhile, I'm like, we can't look at colleges for my daughter because she was at that point. I was afraid to I wouldn't allow my parents to come in the house while he was treating, right? I hadn't seen my parents in months. So when he would not be in the house, I would fumigate the house so I felt like it was safe to see my parents. Just like,
Oh man.
Oh, it's a crazy time.
so scary. And you know what's funny? I guess it's like childbirth. Until you're in a situation like we're chatting about it now, you kind of forget how freaky it was.
Yeah.
I was having staff happy hours on Friday night on Zoom. Well, because I had a lot of people, I not only had to worry about the staff that was showing up and working, but I was worried about the staff that was at home. Once a week on Sundays, I would send cards to 15 people, and I'd randomly choose 15 people either in the practice or patients that I know or personal people, and just send random cards because it really was, for some people, a very, very dark period. So, and no one knew how to act or what to say and there was no roadmap of this is going to happen for the next 2 months and then you'll be fine.
Yeah, I remember in the beginning it was so hey, we're gonna stay at home for 2 weeks and then it'll be all over. And then now, yeah.
So you were out for 3 months. So March, April, May. Yeah, we actually couldn't open. I think it was July 18th that we finally went back to operations, only because the safety committee, all the things that they deemed that we needed, the EOS systems and the air filtrations, all that stuff that we got, we couldn't get everything to up and run until then. And then it was like, I couldn't even tell you how packed everything was. It was just wild. Ben, when you guys went back in, it was nuts, right?
I don't even remember.
You don't remember going back in?
No.
Did you remember stocking shelves? Or you did?
No.
You didn't stock shelves?
I didn't stock
Oh,
shelves.
you just
They never
applied.
called me back.
Never called you back? I thought you were going to say, yeah, he interviewed me, but he said I wasn't the right fit.
No, they never called me back. We ended up getting a dog instead. That kept
Oh,
me
yeah.
busy. Yeah.
Oh, that's so funny.
COVID baby.
So now you're in Austin.
Mm-hmm.
You get through COVID.
Mm-hmm.
You still love each other.
Yeah.
You still want to be dentists.
Yes.
What's the next step?
So, yeah, we got married.
David, you can't talk the whole time.
Yeah, we got
Chelsea has
married.
to talk a little bit.
All right, I'll let her talk.
He's going to be the storyteller.
I was trying to
I'm
think.
teasing you.
Yeah, because it was a long time ago.
Yeah, we got married. And then we had our first
So
son,
you
Miles.
got married, and you mentioned earlier, I think before we rolled, you didn't even have a big wedding.
No. It was 11 people. It was just our immediate family.
That's great.
It's really nice though.
And you got married where?
It was in the hill country of Texas, so somewhere called Fredericksburg. I was on a winery.
Nice.
Yeah, it's a very small, intimate wedding, not stressful at all. Yeah, we booked a nice Airbnb for both of the families to stay at.
Oh,
It
that's
was really
so
nice.
cool.
Yeah.
Yeah.
That was a nice idea.
Hmm.
Nice. Okay.
I'll let you continue.
So we got married in October, and then we got pregnant shortly after with our first son, Miles. So that's what made us want to move closer to family.
I was going to say, so what was the reason?
Yeah,
My heart was always back in New York where my family was. We had no one in Austin.
yeah.
And just like with our profession, it's really hard to just call out when you have all these patients that are expecting you to be there.
I'm trying to not be facial on that.
Yeah.
Yes.
So we needed backup childcare and just having family around for our
Yeah, to like
kids
grow
to
up
grow up with
with
cousins.
yeah,
and-
grandparents.
Yeah.
Yeah.
And we couldn't go to California
Yeah.
You, gotcha.
because of the board exam.
Yeah.
So
I have to
needed
say, I
was.
do love California.
Oh, it's great.
Love
Yeah.
If I could
California.
afford it, I'd be there in a heartbeat.
Yeah.
The taxes alone would kill me, among other things. But the weather is just so nice.
Beautiful.
I feel like the lifestyle, because the weather is so nice,
Mm-hmm.
minus the crazy Pulp Fiction national disasters that they have that are just like mind blowing. But because the weather is so nice, I just feel the quality of life
Yeah.
is nice
agree.
because you're engaged with life more. When you're outside, I just think in general you're engaged more fully in life.
Yeah. I feel like whenever I'm there, it's just a completely different feeling of life, right? Because things are so much more pleasant, right? Because here I tell or complain to Chelsea all the time, right? Like last winter, it was a pretty rough winter, right? It was
was
about
That was that crazy.
yeah, I know 6 months being stuck indoors, right? Because it's freezing, it's snowing, and then
I have
Now it's-
never, in all the years, closed the office a day and a half. It wasn't just a day.
Yeah.
I had to do the half day. I have never.
yeah, like growing up, where I lived, didn't have any AC in the house because we never needed it, right? The heater maybe would turn on like once a year. The coldest it would get is like maybe 40, 50 degrees. I grew up.
I mean,
Yeah.
it's really
You're
nice.
spoiled.
And it's
I
so
know.
pretty. And it's so pretty. It's so pretty that if you're along the shore, because of the hills and everything, you could see the water so nicely.
That's where
I
you
mean,
grew up.
Yeah,
It's
I took it for
beautiful.
granted, definitely, because you grew up looking at that every day, and then when you don't see it anymore, you just really miss it.
it's funny. I was watching a podcast with Bob Saget's wife, Kelly Rizzo, and she said she was talking about accumulating things, and she bought this big house with this view, and now she's thinking to herself, did I really need this house? Half the time she doesn't even pay attention to the view. And that's one of the things that has been resonating with me lately. Like, are we focusing on all the really nice things that are going on? I mean, you can't avoid the things that you have to deal with, but do we snap back and appreciate the beauty of things? So in the snowstorm, it was really pretty, though.
I guess you could say that. Yeah.
And I'm sure, I mean, you shoveled, so you got some
Yeah.
exercise.
Yeah. Well,
You
we have
went-
2 young kids at home, and all you can do is entertain them in the house. It can get a little bit challenging.
Oh,
Yeah.
yeah, that was probably a rough one this year. Okay, so you moved back to New York,
Hmm.
following the story. And did you move immediately to where you're living now, or
Yes.
okay?
Yeah.
So and you love your community. We talked about that when we were interviewing, and you immediately clicked into your family. Your family's still living where you grew up and everything.
Mm-hmm.
I love that.
Yeah.
I know my parents still live in the house that I grew up in.
Yeah. So do my parents.
Yeah, me too. Yeah.
I love it. It's so. By the way, it's so rare,
Hmm.
but I it's so nice. I love it. Okay, so then what? What are you deciding? How do you come back to New York? In your mind, when you're thinking about a practice, you had a little bit of experience in Austin. What are you looking for?
I mean, I personally knew I didn't want to do corporate ever again.
Yeah, 100%. I agree.
I wanted a private practice, especially with the experience I have now. I'm so much more confident as who I am as a provider, and I wanted that close-knit family feel of a private practice.
Yeah, I would say I'm looking for the same thing, an established private practice that really focuses on caring for the patients, also caring for the providers, all the employees, right? Because coming from, experience with a corporate practice, really everyone who's working for them, they're all expendable, right? Every single patient is also expendable. They're just numbers, they're just statistics, right? Everyone's plug and play. Like if you're gone, they'll replace you the next day.
Yeah, that doesn't resonate with who I am, but
Right.
I have to tell you, the other way of how I am is very exhausting. It's a lot.
Yeah.
When I walk in, you look at me like, yes. Yeah, no, I think that, and I've said this before in prior podcasts, Cliff really wanted, and it sounds corny, but it's just really how he is. He wanted to treat patients like family.
Mm-hmm.
He'll say the cousin he likes, the cousin you like, the aunt you like. Yeah, he just really wanted people to have an experience unlike a dental experience that maybe put them on a path to stay away from the dentist. He just wanted to recreate that for every patient. And it's hard to so he goes out and he does that, but what happens is when you're like that, it's unlike everyone else around you. So you start collecting more and more of a following, a patient following. And that's how it happened for us. They got bigger, he had to hire more people, and we got bigger. We went from 4 ops to 6 to 9 to moving the location because we couldn't do more than 9 to 15. Then we were booking out 9 to 12 months for new patient. We said, all right, let's pick another location, and we went on that whole journey of again, we were building based on need. So we didn't open and just hope to build something from there. We opened based on the need that we actually had internally. And then so you're in that space, but then the back end of it is finding providers of like mind and willingness to participate in that space.
Right.
That because it's not. I've learned and again, I talk a lot about energy. I know people think I'm crazy, like a witchcraft person, but there is an energy in everything we do, right? And people, especially in the chair, because a lot of what you guys do, it's almost empathic in the sense that you're transmuting, you're calm, and this is okay, and you're going to be treated. You're transmuting it because you're not. There are some patients where you're working in their mouth and they don't want to talk to you. So that's all of that is an energy exchange. It's happening from here across, and then it's happening from your hands as you touch them. And a lot of people that to give that, you have to own it in your body. It can't be manufactured because it won't be received by the patient. And I think the hard thing is then finding that group that can do that. And again, it's got to be from the patient experience coordinator greeting the patient to the assistant grabbing, bringing back the patient, giving them the tour, to the hygienist, to the doctor, back to the hygienist, to the PC, patient coordinator, checking out the patient. It has to happen. And while everyone has different energy spaces, everyone delivers it differently, we're delivering something. And we're all kind of in alignment with that intention of it, right? And it's hard to find. So that's why when, one of the things, I think there was at one point when we were going back and forth with the recruiter, I think you passed on the opportunity, or I didn't hear back from you. Maybe you were thinking about it. And I was so sad because I had felt that 2 things. One thing I loved about you was I felt that what I'm talking about resonates for you, and that's who you are. The second thing, though, I did hear a little bit about your prior experience and what you wanted, and I really did feel for you as a provider, you would love the experience we could create together. And when I didn't hear from you, and I can't remember if you said no or you were just continuing to think on it, I was like,
I believe I was working somewhere else at the time.
maybe.
Yeah.
I said to Marsha, ugh, he's going to be like, you know, the one love of my life that got away. She was like, nah, you know, we'll see if it's meant to be, it's meant to be. I'm like, he was just so good. And I said, you know, I'm like, I just hope he finds, because he will, if he's in the wrong environment, he'll get chewed up and spit out, because that's what some other places do. And oftentimes also in private practice, you never know what you're going to get until you're in the home and you're living there for a bit, because some providers believe that what they have is that, but when you're in it, it's kind of different. There's like a disconnect from the belief and what it actually is. But yeah, so you came, you joined us, and then you were working somewhere else, and then he must have been writing good reviews, and you were reading the good reviews.
Yeah.
Okay.
It happened. Yeah. He was having a good experience.
Did you ever think you would want to work together?
I mean, I always wanted to work with him. It was never the right opportunity,
Right.
but I was excited to work with him.
Because I don't think we ever actively sought a position together at the same place.
You didn't.
Yeah.
Yeah, I mean, when you approached me about it, I think you thought maybe I would be like, no, but I thought it was great. I was like,
Yeah, you loved
I mean,
it.
I was more nervous. I just didn't want to, you guys to put some kind of, like, at the end of the day, if something happened because you worked together, I'm like, I don't want this on me. Like,
Yeah.
because I said yes, that they could work together, and then their whole life explodes, you know?
Yeah.
So you end up working together. Do patients, do you think they know you're married?
Well,
A lot
now
of
they do, because
patients
we've been there
do.
for a while.
Yeah.
Yeah, usually when I'll see someone and they'll be like, oh, I met your lovely wife the other day.
Okay, so there, because we don't, on the marketing side, it's not like we necessarily
Right.
announce it or attach the two.
Yeah.
Yeah.
So,
Or if a patient's like raving about David, I'm like the proud wife. I'm like, oh, that's my husband.
oh, you do? Okay,
Yeah.
good.
Yeah.
That's my husband.
Cute. I
Yeah,
love
we
it.
don't hide it. Yeah.
You don't hide
but
it, yeah.
I don't like advertise it unless it falls into my lap.
Yeah, I'm the same way. I don't advertise it
Yeah.
unless it falls into my lap every day of every minute. Okay, so fast forward, you go on. We're going back to the honeymoon that you never had. You come back, and then a few months later, you find out you're pregnant,
Yeah.
and you have your second son. All right, so let's talk about that.
Okay. So our second son's name is Cooper.
Well, let's talk about Miles too for a moment.
Yeah. So
How old is Miles now?
He's almost,
it 4?
He's almost 4.
In September, he'll be 4.
Nice.
Growing up.
When's his birthday?
September 9th.
9th. Okay. He's not a Libra. He's the sign before Sagittarius. I don't
Who
know
is he? I don't know.
the
Oh,
sign.
He's not a Libra?
No,
No.
it's later in the month. I think it's the 23rd, 24th. But yeah,
We'll have the producers check.
exactly. Deb, take a look. Let us know.
Yeah, Miles is great. He's the best older brother. He really is.
Yeah, it's really, really nice to watch their personality develop. You get to kind of see what person they're going to become, their sense of humor. You know, he's a really silly kid. He's a little bit sensitive, you know, not super outgoing in new environments. He reminds me a lot about myself when I was younger. And I don't know, he just makes us really happy. Yeah.
Okay, so then Cooper comes on the scene.
Cooper came on the scene during our anatomy scan. We found out that he was going to be born with a cleft lip, and they told us cleft palate as well.
So how? Well, I don't remember all those tests. How far along were you?
20 weeks.
Okay.
So
Yeah, that was very difficult news to hear, because it's not something that you're ever expecting
Right.
something to be wrong on one of those scans.
Right.
So,
So we did the genetic testing.
Yeah.
Everything was fine. That's at 12 weeks. So we went into that anatomy scan, like not thinking anything. We were talking about ordering pizza. We
Yeah.
were waiting to order pizza. We were like, let's just see when the doctor comes in. We were
And
sitting
then
there
we were
for like
waiting
an hour.
and waiting and waiting. I was like, what is going on?
Yeah, and he
Oh,
wanted
they
it-
didn't even let you go.
No,
Wow.
because the doctor was finishing up with all the other patients to come give us the news.
Now, is this standard testing? Because I don't think I had this.
Yeah.
This is now
Yes.
standard? Okay.
Yeah.
the anatomy.
So yeah,
Scan
20 weeks the
standard.
anatomy scan. So they take all the measurements to make sure the baby is going on track and to see if
They
there's any
count,
sort
like,
of
They count the fingers, they count the toes, they
Yeah.
count everything.
Okay.
And then they recommended, like, I did an amnio just to make sure, which I did, and everything was fine on that end,
Mhm.
but it was hard.
Yeah.
Because I mean, they could tell. You can tell there's a soft tissue issue. They were thinking there was a hard tissue issue.
Why
but
don't
you
we
can
tell
never-
people what this is? Because some people may not even know. I
Right.
mean,
Sure.
truthfully, until you told me, I researched after you said something. I had heard it once or twice, I think,
Yeah.
in my 50 years.
Mhm.
So,
It's hard to see in America because the standard of care is greater here. Because most people, if they have it, it's been treated.
okay.
Right? More times you'll see adults have it is in third world countries. But what was the percentage of people that are born with it? It
Well,
was
globally, it's 1 in 700.
Wow.
In the United States, it's like 1 in 1,000. So it happens around like 4 weeks. It's really early. It's when the cells are multiplying. The lip doesn't fuse properly. The cleft lip and the cleft palate, they form at different times. So you can have one without the other. We were told that he was going to have a cleft lip and a cleft palate. So that's what we were mentally preparing for. So we were interviewing a bunch of different Cleft teams to deal with the future after our son was born.
yeah, because that early on, there's just so many unknowns too. Because they can't tell you the extent of it. They could just tell you they see something on the ultrasound, and basically you won't find out until the baby is born and you get to look at the baby to see how bad it is.
So, do you assemble the team so when
Yes.
he's born,
Yes.
do they initially, as soon as he's born, they do an exam?
Depends on the team. Right?
Okay.
Yeah. So when the baby is born, I remember when Cooper was born, I was taking pictures and videos to send to the plastics team, the plastic surgery team.
Okay.
Because we chose a team in New York City instead of a team on Long Island.
Okay.
If the team was on Long Island, they would have came to the hospital and they would have assessed, but we chose a team not on Long Island. So we took videos, and then he was seen like 2 days after birth. We drove into the city, and we found out he actually didn't have a cleft palate,
Yes.
which was amazing. Best
Yeah.
case scenario.
Would that still have been a surgical team for cleft palate?
Yes.
Yeah.
Okay.
Could have been
So,
more surgery.
More surgery.
so right now he had a cleft lip and a break in his alveolus, which is basically where your teeth lie. So right
Okay.
at the bone, he has a break right there. But it doesn't extend through the palate. The palate is an opening that actually would be open to the nose. So around 3 months, they do the cleft lip repair, and they don't do the cleft palate repair until
He was
like
8 months.
8 months. So he didn't need that surgery. So feeding's a lot more difficult because he can't have suction if they don't have a palate.
Gotcha.
Yeah, it's basically a hole going into your nasal cavity.
Yeah. So thankfully he didn't have that. But since he has the break in his alveolus, he will need a bone graft when he's like 7 or 8 years old for his adult teeth.
Okay. And what type of doctor does that?
So the team that we chose, we really like this whole group because in that one medical suite, they have basically every specialty that he would ever need, right? So there's the plastic surgeon there that would be performing the surgery. There's the orthodontist that would be, helping with the appliances that he would be wearing prior to the surgery and after the surgery. There's the dietitian. There's the speech pathologist. So everything that could be.
Do you think that speech will
involved.
be an issue?
It's more likely if he had a cleft palate.
Yeah.
Because also when you have a cleft palate, the way the upper and lower jaw form is different. They're more likely to need surgery to position the jaw properly. I think the jaw is either underdeveloped or overdeveloped. I'm not really sure, but the cleft palate has more speech involvement, ear tubes. So we were anticipating
Everything.
all of
Yeah.
this.
Worst case, yeah.
But thankfully it was a lot smoother journey than we expected.
I mean, I think 1 or 2 weekends ago you were posting pics. I wouldn't even have known.
Yeah, the surgery was great. The surgeon was amazing.
Yeah.
Yeah.
Was he in the hospital a long time?
He went home that day.
Just
Yeah, that
oh
day.
wow,
And the
that's
surgery
incredible.
was-
Leading up to the surgery, we were working with an orthodontist, and we were doing nasal stents and lip taping to bring the lip together and reshape the nose prior to surgery, so
Recovery.
the surgeon could approximate the tissue better.
Oh
So
wow,
it's basically
Less
like
tension.
less
that's
tension.
incredible.
Yeah.
That's incredible.
So they did a great job.
That's
Yeah,
great.
very
Well,
fortunate.
I'm glad that for now is going to be behind you. Correct.
Yeah.
Mhm.
Wow. I can't even imagine the stress of that.
Well,
I
yeah,
don't
you
do-
never expect it to be you.
Yeah.
No.
We had a healthy first experience, and we went into this second thinking it would be the same thing. I mean, he is a healthy, beautiful boy, but we just didn't expect that.
Is he walking yet?
No.
Yeah. Boys are late. How
Yeah.
how old before when Miles?
Miles.
Miles was 14 weeks, or 14,
14
months.
months.
When he started
14 months.
walking. Yeah.
Yeah. They like to laze it out.
Yeah.
They like to make us work more, right?
Yeah.
I think we're hitting like all the questions. So, let's talk about your clinical space. One thing that I love and the feedback that we've gotten from patients is, I'm the pillar person. I love to talk about the 3 pillars of service. I think that that service conversation falls across any trade, any consumer. I think everyone deals with, you need to connect with your consumer, you need to discuss finances with your consumer, and you need to be able to deliver whatever service they need in the best way, right?
Right.
So I love it for dentistry. I love it for our practice because I think that, we're all about team development, which you guys have participated in a lot of that stuff and helped us with. And when you're developing people, it's great to have like a vision of what exactly we're talking about that would create an experience that exceeds an expectation, or what is the ideal situation to treat your family member, right? So what I love about both of you, and I was looking at the reviews for Gateway, is the patients really feel like they're your person, like that you really cared for them. I think for a patient, I think for anybody nowadays, while they love a good review when they get something they don't want, I think when you see a good review, that means you delivered something 50 times over their expectation, that they felt compelled to share it. I don't think that people naturally like to talk about the things that they appreciate. I think as a society, we're taught to be complainers. So, but you guys are jammed with reviews where, you're mentioned, names are spelt correctly, your assistants are mentioned. I love the fact that I'm a name speller. I like to spell the names right. But I love that they will mention your assistant or your patient coordinator, which means that you're really infusing that sense of community in what you're giving them. And they feel that, which is really great, because I don't think, and I have the utmost respect for all of our clinicians. I'm not a dentist. I just pretend to be one, but I really respect what you guys do. I could never do it. I couldn't even get through the study of it. I definitely wouldn't. I would never make class with the smoothie, but I respect it tremendously. But to be able to do all of that and share with the patient that it's a collaboration, that's something that's very special with both of you, because most providers are not necessarily comfortable in that space. They make the relationship more provider-patient and not leaning into, look, I'm here, I'm delivering this and hitting the pillars, but Courtney's helping me. And Jocelyn's doing what she needs to do, and all these other people are helping me serve you. So that's something that's very special about both of you. How does that feel when I'm saying all that?
Yeah, I mean, it's because it's when you say, treating people like family, it's an easy thing to say, it's a hard thing to do, right? Most people can say it, but they don't really do those actions. I think a lot of it is like experiences that I've had with me myself as a patient, not necessarily at a dentist's office, but like at a doctor's office or something like that. And certain things I just don't like about the experience, right? Like the doctor can come in, no eye contact, they don't even look at me, they don't even introduce themselves. They're in there for like 2 minutes, right? And then how am I supposed to feel as a patient, especially if they're, supposed to be, educating me, trying to help me in any way, right? There's no real.
Well, what schooling did you get for that? I go back to the schooling. I don't think any dental schools, I don't think medical schools really spend an equal amount of time on the relational component of what you should be giving in service.
There's probably none. There's no classes on that.
No, there was one class. One. Yeah. It was like practice management, and it talked about like the different
Oh, that's
emotions.
good. So if I want to move to the West
Yeah.
Coast, there's probably a place for me in teaching.
Yeah.
Okay, go
It's
ahead.
about like the different emotions
Right.
of patients and how to read patients and emotional IQ, and
Yeah.
it's all about that.
Yeah, I just want, because the way I think about it too is, if I was in that chair, how would I want this appointment to go, right? Or if my mom or dad was there, how would I want it to go?
I feel the same way. That's why I'm adamant and I'm constantly repetitive in my speech and everything that I say. I mean, it's very rare that, and by the way, that's why like randomly on a Saturday, you're going to get an email from me about the 3-week protocol, because I'm always seeking to find ways to make it easier. Because look, the reality is I have 98 people that are under my charge to figure out how to make sure all of this is happening in a very similar way, meeting our goals and intentions, right? So for me, I'm the type of person, I came from a classroom, I was an educator, so I think like this, so I'm very aware of, I have a high emotional intelligence sometimes. IQ's there too, but I'm showing up whatever I'm doing, bringing all of that. But there are some people that aren't necessarily showing up or thinking about all these things, so they need someone like me to set forth a 3-week protocol, the 3 pillars. Let's talk about what a category of 1 was. That's not a new concept that I created. It's something that was out there, but I think it embodies our intention of treating people like family and creating an experience that exceeds an expectation. And when you're working with people, if you can deliver to them something to hold on to and aim for in how they show up in their professional space, that's the best thing you can do. It's one of the reasons why we're very proactive. And again, I'm not going to say that leadership is perfect in our practice, and things are growing and changing, and we're trying to grow and evolve with it. But we're very proactive in figuring out where team members might need help, and do we need to have them on some kind of plan where we can work with them and develop skills that maybe they don't have. Whatever it is, it might be technical, it might be transactional, and it might be relational, but can we help develop them? Because I do think that if someone has the desire to go there, there's that willingness is the first step forward that we need to take together. Whether or not after a while, if they don't have the skill, it's going to come through, and then we can make a decision. Maybe it's mutually decided upon that it's not the right fit. But if someone really wants to try, I'm like, let's figure out how to give them, the support to try with them, So yeah, I think it's, and I love the family thing, because I think when, you if you brought your mom into our practice, you'd want to know that she knew everything she needed to with her insurance, that everything she was explained things, that she got nitrous, that she, knew everything that was going on, that she felt good about all the interactions.
Right, because it's such a,
Someone
this is a very
looked at their,
difficult field, right?
Yeah.
There's so many barriers to a patient not just getting what they want, but like what they need. Because a lot of what we do is it's medically necessary, right? There's just so many things that can go wrong that can break a patient's trust, and it really is up to everyone that when the patient walks in, it could be the first person that they see at the front desk. That's the first impression, right? Because
I think, yeah. That's why we have a patient coordinator, a patient experience coordinator, because we feel that it's very important from the moment they walk in, the moment they back away from that door closing, someone's there to say, good morning,
Yeah.
you know?
It's not a good feeling when you like walk into an office
no
and the
one looks at you.
reception,
Yeah.
the receptionist doesn't look at you and you don't even know what to do. Like, do I
Yeah.
sign in? What do I do? And no one's
And
paying
you're
attention
waiting.
to you.
And you're
Yeah.
awkwardly waiting.
Yeah.
It's worse than
It's not a
being on a
good feeling.
podcast. You're awkwardly waiting. But I know. I have that all the time. And
Yeah.
I told you about an experience I had at the dermatologist. You know, I have a precancerous lesion that they did a biopsy on. Now they want to go back in and get more. The doctor didn't even call me. If we did that,
Yeah.
I would be like all weekend trying to deal with getting in touch with the patient. Like my whole weekend would be blown up trying to change that experience and figure out how to have that conversation with the doctor to understand why
Right.
on God's earth they would not call the patient. You know, and
Yeah.
what's challenging and rewarding in our practice, if you're a go-getter, which both of you, to me, you seem like go-getters. I'm a go-getter. We've created an energetic exchange with our patients where they have a high level of expectation of us. So unfortunately what happens is if there's one misstep, and by the way, it doesn't even have to be a misstep. It could just be a kind of tilt off the map. They're all over us, you know, and well, things are changing. Yeah, things are changing. I have new doctors. I have new team members. I mean, I'm battling the same things that your GP's office is battling. And by the way, they don't even speak to you. But I'm trying to do it better than that. So my bar's higher, which means it's even harder for me to create this team that would deliver that to you. But they get it becomes challenging.
Right.
In that sense, and then you get them in the chair and you're telling them they need something and they don't hear it as that, and then you tell them the amount of money and it's like, you know, every barrier is just totally thrown up, and then what, you know?
Yeah, I mean, I think it's good though that the patients have high expectations of us in our practice. I mean, it holds us to a higher standard, right? We have to be accountable.
I like it too because I'm a go-getter. Like I honestly never want to do what we're doing last year. But that's me. And I'm crazy like that, but I'm always on that wheel because I just always want to be better, you know. You know, if I have my best day is to sit at the beach, read a good self-help book. And, you know, heal a little bit more of me and share it with others. That's like my best day. But not every, you know, some people it's hard to constantly be moving in that space.
Yeah.
How does that feel for you?
Yeah. I mean, I just always want the patient to have the best experience possible. That's what I'm working towards every single day.
Then now we're going right into what I've been dying to talk to you about all day. I'm going to say it wrong.
Xeomin.
Xeomin.
Yeah.
Xeomin. I butcher it. I could spell it probably, but not say it. Yeah, so that's one of the things I was thrilled that you brought to the practice. So tell us a little bit about that.
Sure. I mean, I think one thing that a lot of dental schools fail us dentists on is the education on oral facial pain. I don't think we get much education on
Right.
like TMJ at all. So when a patient comes to us, it's not that we're dismissive of their symptoms. We genuinely don't know how to treat them. And a lot of the times it's referral to the oral surgeon. That's how it was most of my career. But when I started studying to get into dental school, I was getting this chronic ear infection, going to my doctor. They were putting me on steroids. Finally, they sent me to an ENT, and they were like, it's not your ear, you're grinding your teeth. I had no idea that was even a thing. So I sought out something to help me feel better, and that's when I got into treating muscular issues with Xeomin.
So did you do a night guard? Because I had that as a child. I had
Yeah.
a lot of like childhood anxiety, and I was a grinder.
Mm-hmm.
So and it was a bulky, uncomfortable, torturous device.
Yeah.
So you did that.
Yep.
And
I wasn't
then-
even in dental school yet, so I got a night guard made.
Okay.
But a lot of the night guards made now actually can make the symptoms worse depending on how they're made.
Yeah, that's something I recently, one of the patients that I connected with had said that to me, and I spoke to her about you. I don't know if she ended up with you, but we can talk about it. Because she said the night guard actually made her worse, and also moved her jaw where it wasn't in the same.
So it depends on the type of guard. There's so
Right.
many guards out there.
Right.
I'm by no means an expert in this field.
Right.
But like every day I'm striving to be more educated in it, continuing education in this field because
And a lot
I'm
of it, by the
passionate
way, is
about
just
it.
talking to your patients
Yeah.
while they're in treatment with you, I'm assuming, right?
Yeah. I mean, my main goal when a patient comes in and I see them for a consult is trying to figure out the source of the pain. Because the patient will always come in and say, I've had TMJ for years. But a TMJ is a joint that we all have. And it's not really always the issue that's bringing them in. It's not always a joint issue. A lot of the times it's muscular issues. The muscles around the joints are creating pain that they just think is their jaw joint. Sometimes it's also neural, like trigeminal neuralgia people have, and that creates facial pain. So there's so much that goes into it that it's not always just one diagnosis, and that's what I'm trying to figure out to help them.
So talk to us about Xeomin.
Sure.
And what it actually does and how it's used in treatment.
Sure. So it's comparable to Botox that everyone knows. It's just a different brand. And when patients are experiencing large facial muscles from clenching and grinding or painful facial muscles, Botox, Xeomin can help to shrink that muscle to reduce how much force you're putting on the teeth, but also to help with the facial pain. It doesn't stop you from clenching and grinding. It's treating the symptoms.
So because I mean, I go for Botox, you know, I don't even want to say how much a year, how many times a year, but it's more and more as I'm getting older.
Mm-hmm.
I thought it was going to be less and less, but I think it's new spots. I don't think it's the same one because I think I'm deadening the other ones, and then a new one pops. But is that the same type of thing where it wears off, or
Yeah.
do they build? Does it build in the body at all?
No, it wears off just like if you were getting it for cosmetics. But as you shrink the muscle over time, you should need less and less often because the muscle's not as strong and overactive.
So it's a similar. Okay.
So it's
That's
similar
what
to like treating any other muscle. But what I've recently started doing is trigger point injections with an anesthetic into the muscle as a diagnostic tool to confirm that it's truly a muscle issue and not a joint issue. Because if they get instant relief, that tells us that it's a muscle issue and not a joint issue. So
Interesting.
that's,
And then what would happen if it is a joint issue?
I refer them to an oral facial pain specialist. Because
Interesting.
if it's a true joint issue, they would need other type of imaging to see what's going on. And the injection would probably be into the joint, not the muscle.
Okay.
So sometimes they'll inject like a steroid or a lubricant into the joint to allow the disc in the joint to move more freely.
Interesting.
So my job is just trying to diagnose as best as possible and point the patient in the best direction.
Once you start on treating with the Xeomin, does it ever move into a joint situation or no?
Not if it's a joint situation.
Okay.
I mean, if it's
not
strictly
like
muscular,
something that would pop later.
no, I mean, things can happen down the line, but
Right.
usually when I'm treating the muscle, it's a muscle issue,
Gotcha.
and most people are getting relief from it.
Are you also treating with a device?
Not always.
Okay. Are you integrating with myofunctional therapy at all?
Myofunctional and also sleep, because a lot of times the clenching and grinding at night is due to a airway issue. So like I tell patients, I'm treating your symptoms, not the root cause. So if the root cause is clenching and grinding at night, I want you to get a sleep study. If it's during the day, there are things that we can do to be more mindful. There are apps out there that make you more mindful of clenching and grinding. There are other modalities like acupuncture really helps to relax the muscles, and different things that they can try.
That's interesting. That's one of the things that I am very excited about in this practice is like this integration that I want to say it's whole body, because there's so many, we do have so many different providers that are in different spaces, and I'm like, oh, that's really like great. I had a dinner last night with Lauren, and she was talking to me about this this wand for oral cancer screenings, and I said, all right, let's look into it because that might be something that makes more sense. But I looked into it and I read a lot, and there's a lot of sometimes false positives. Also, the
Smell,
device is
yeah.
incredibly large, and it may not be able to be moved the way we would need to in our practice. So I'm not sure if that's, but all these things, I love that we do have a group of providers, including our dental assistants, including our patient coordinators, that have seen or heard about things that they would love to bring to the practice. And if it makes sense, we'd move to it. But yeah, the Airway Health Department, I think, is going to continue to piggyback it with dentistry real nicely. That's very interesting. How long have you been doing the treatments? You started in Austin?
Yeah, I started in Austin. Maybe 4 or 5 years.
Interesting. And let's talk a little bit about your bells and whistles. Tell me about, I mean, you do a lot of great work, dental work. What are some of your top favorite procedures to do?
I would say one of the more unique things that I can do that sometimes patients will have a little difficulty finding a provider to provide that sort of treatment is something called Icon, resin infiltration. So you've seen people with, like white spots, brown spots on the teeth.
Right.
A lot of times you'll notice teenagers having it after braces. Could be from fluorosis, but essentially it's a non-invasive, it's a more conservative treatment option to improve those aesthetics without needing to drill into healthy tooth structure, without needing to give any painful injections or anything like that, and with a great aesthetic result.
And that wouldn't be a whitening situation?
Typically, no. So because of these lesions, I mean, there's a few ways you can get these spots, right? So number one, like I said, it could be from decalcification. So, in your mouth, there's always bacteria, right? In your mouth, there's always sugars and carbs too. So the bacteria feed on that, and acid is a byproduct. The acid starts to eat away at the enamel, which starts to make these little chalky white areas on your teeth, right?
Okay.
So that's usually what we'll see with patients with braces, ortho brackets. It could also be from fluorosis. So, let's say a young kid, their adult teeth are still developing, and if they ingest too much fluoride, sometimes you can develop fluorosis, which is those white spots that can pop up on their adult teeth.
Is that common here? Because I mean, I know we were talking before the podcast. We don't have fluoride in our water here, right?
No,
Right,
I don't see it too much here.
Okay.
I'd say
Yeah.
most of the time I'm treating this, it's either developmental.
Okay.
Because you can also get it if when you're young, let's say you have some sort of illness, malnutrition, something like that, you can develop white or brown spots too.
Okay.
But I would say majority of the patients I'm treating are ones that have had orthodontics, where they've taken the brackets off, and then there's white and brown spots from those areas that they couldn't clean properly when the brackets were on. And so that's mainly the patients that are coming to me.
Are you getting a lot of referrals from Dr. Baker?
Dr. Baker?
Yeah.
I'll have to look into that.
We should have that conversation with Dr.
Yeah.
Baker. That might be a nice offering at the end of braces to add on, to be honest with you. Because
'cause
there are a lot of kids that,
Because most of the time, right, because these patients, I'll see them in the hygiene chair and I'll bring it up to them, how do you feel about these white spots? How do you feel about these brown spots? I would say 99% of the time what they say is, oh, I've always had that since I was a teenager.
but you don't
Yeah.
have to have it.
Yeah,
And it's not,
exactly.
we're not talking about a lot of money. So,
Yeah,
you
and
know,
the main thing is they never knew that it was a thing that could be fixed, or if they were suggested a fix in the past, it was something that was more invasive, right?
Right.
So that's basically, back in the day, you would have to treat it like a cavity. You would have to numb the area, drill it out, even though it technically is not active decay, and then place a filling material in as if it was a cavity.
that sounds crazy.
Yeah, that's
That
what
sounds
kind
absolutely
of
crazy.
dissuades a lot of patients from seeking that treatment is how invasive it can be. But I mean, this option, it's much more conservative, and I think you could get a much better result in terms of the aesthetics at the very end.
I love it. I know you spoke about it at the doctor's workshop. Did anyone speak to you further about doing it?
What do you mean about patients?
Yeah, about working on patients with it? No, because I know you presented it.
Mhm.
And I don't think anyone knew that you were
Dr.
doing
Yeah,
it.
Dr. Contreras does
Okay.
it. Dr. Azin does it
Oh,
as
okay.
well. Yeah.
I wasn't sure if I wasn't sure that was happening.
Mhm.
Okay.
I think it's a great thing to offer because I think still a lot of patients don't know it's a thing, right?
Well, they're going to now
Yeah.
because we're going to market the heck out of this segment. But that's the practice that I love to talk about and be a part of is bringing things to patients that they don't even know, especially in a situation where they've tried they see a whitening gel, they go buy that,
Right.
they have a closet full of crap that never worked. The dentist had no solution,
Yes.
and then someone can create one that isn't invasive.
Right.
Again, because you've taught me, because I know you're not going to do that to me, but you don't, why take a drill to a good tooth?
Yeah, I just had a patient last week to see me for a consult for it. I mean, very young patient, probably I think like 19 years old or something. She had a white spot on the front tooth, and she had never treated it.
So when you say white spot, so her tooth was maybe like a few shades darker, and then there's a spot that's real white. So I've actually never seen this.
So
I mean,
the-
I saw it after the kids
Right.
had their braces removed,
Mhm.
but then it went away. We didn't address it. It just went away.
So the entire tooth itself is still healthy. There's really no discoloration in the rest of the tooth structure.
It's
a localized
relatively
defect.
white.
Right. It's
Okay.
the same as the other teeth.
Okay.
It's a very localized defect. Sometimes it's just a little spot in one area. Sometimes it covers half the tooth.
Looks
Gotcha.
like it could look like snow capping.
Right.
Deb's giving me imagery.
Right.
Yeah.
So I had a patient that came in last week.
Yeah, I mean, some
for-
of them are real bad, but some of them are
Yeah,
mild.
but
And yeah.
it was, I would consider it a mild white spot that she had not treated, which I'm glad she did not because the previous dentist was recommending cutting the whole tooth down for a crown.
Oh,
Right? And
my
this is a young
gosh.
patient, right? So you got to think about whenever you work on a tooth and you drill it down, that enamel or whatever tooth structure is not going back.
Yeah.
Whatever you put on the tooth eventually is going to fail. When
Right.
it fails, what are you going to do after that?
Right.
Right. So this is kind of the process of trying to delay that death cycle of the tooth.
Right.
Right. Doesn't matter if the patient's young, doesn't matter if the patient's old. Nothing's going to be better than having a real tooth in the mouth. Right. We have
Right.
a great surgeon that can place great implants, but
Right.
your natural tooth is always going to be the best.
Right.
Right.
I love that. Yeah, I mean, yesterday, I've been really struggling with perimenopause and all these different hormones that they're putting me on. And it's like one of those things, and it's similar to what's happening in dentistry for women. Every day there's something else coming out. Like they're now finding, because there's a group of people now using DHEA, there's a group of people now on progesterone, like there's so much out there that now women can use, and it's great. So I finally sat with a provider who was like, you don't have to suffer. And I'm thinking like, this is the stage I'm in, and these are the things that are now going to be on my new life checklist. I'm going to deal with brain fog. I'm going to deal with increased anxiety. I'm going to deal, and by the way, I'm looking for, I'm very stressed. I have a lot of responsibility, no. And she's like, no, there are a ton of things that are out here. And she rattled off like 6 things that I've been researching up the wazoo, and I didn't even hear yet. So I felt like I took I actually cried in the chair in her office because I felt such a relief that there was something out there. And by the way, she hit things that I didn't even have in my head were on my list of annoyances, you know, and I'm in love with this woman now. And that's the experience that I like that we're able to create, and why, you know, Airway Health is such a nice integration as well. Talk to me, like, I also believe like wellness scans, because I know you're a big wellness scan guy. I know you do them too. So talk to, like, what's a benefit for you as a provider on doing a wellness scan for a patient?
Well, number one, a lot of patients have never seen anything like that before, so they're unfamiliar with the technology. So,
Talk about the technology for me though, because people don't even understand what it is.
yeah, so wellness scan is basically a full mouth digital impression that we take with an intraoral scanner, an alternative to taking traditional, you know, the goopy impressions with the alginate, and you have to pour up a stone model and then you have your teeth, right?
Right.
But we can essentially digitally archive every patient's mouth. Either number one, to have a baseline, you know, see where they started, because most patients, when they see their teeth, it's looking into the mirror when they're brushing their teeth or flossing their teeth.
Right.
And then maybe sometimes their dentist will show them an x-ray, but they don't know what
I don't even know.
Yeah.
I don't, an X-ray. I'm like, half the time I'm
Yeah.
like, that's really not my
that looks
mouth.
like a little gray, a little dark.
Patients
yeah.
say they look like toes.
Yeah.
Like,
Yeah,
those
yeah,
look like
yeah, yeah,
toes.
yeah.
So it helps because the you know, the digital scan, you can blow up a tooth to look right at it. If there's an issue, if there's a crack, there's a failing filling, recession, grinding, anything like that, you can blow it up and it's right there. You know, it's indisputable.
So you're not necessarily, when you're doing that, you're not necessarily diagnosing for an issue that's happening. You could also diagnose or point out something that would happen.
correct.
Okay.
Yeah. So
It's just to educate. It's to educate the patient about what they can see and what we can see.
right.
So we could tell them they have a crack in their tooth, doesn't bother them, they can't see it. So to them, it's a non-issue. But if we're able to show them on the scan the crack and how it can affect them if it's left untreated, they could better visualize it.
Yeah. And the
I
good
love
thing with
it.
the scans is you can, you know, each patient that comes, let's say every 6 months, you could take a scan every 6 months, and there's a feature that allows you to basically time lapse it to see a difference between that first and second scan. So you'll be able to see certain areas have
So
worn down.
you can watch, because Cliff has the big title of "We're gonna watch this tooth." So you can
you
watch.
can track things. Yes.
You can
You can
track,
them.
watch.
You can visualize how they're changing, right? So that's, like I said, these are all concrete things that the patient can see. They can't dispute that it's not their mouth, it's not happening, it's right in front of them.
Right.
Right. So a lot of times it's really good for patient education.
And we don't charge for this.
Nope.
Love it. Do you do it at every exam?
Yes, we should.
We should.
Yeah.
We should.
Would that be in when you're doing the exam in your rooms or more in hygiene?
So usually it's in the hygiene chair. A lot of times when I'm walking into the hygiene room for an exam, the scan's already up, and a lot of the times the patient is the one that brings something up to me in their scan. They say, "Oh, look at this. I don't like the way this looks." So that's, I mean, this conversation starter.
I love the whole description of it because that's so relational. It's like you're taking away your white coat and you're really like sitting next to them and saying, "Hey, let's look at your mouth and where we can continue to keep you healthy. It might not be today that we're doing something, but let's take a watch on or take a what's the word you use? Tracking.
Tracking.
Let's track that, you know, let's put this tooth on a track and track that, you know, but it's that conversation where you're including them in their care initiative.
Right. 'Cause
Right.
everyone that comes in, you know, they might be looking for a different goal, right? But eventually they're all looking for overall the same thing. It's just for nothing to hurt them, for them to be stable, for them to be healthy. This is just one of those tools that we can really help make that happen.
I love it. I love it. Do you want your boys to go into dentistry?
I don't know. It's a tough field. I think in the future it's gonna be even tougher, right? It's gonna be very competitive. Cooper loves to look into my mouth, so who knows?
Have they been to the office?
Miles
Yeah.
has.
Yeah.
Cooper
Miles
hasn't.
has.
Yeah, my grands love it. Aria had her first hygiene visit.
Yeah, It's
She
important to get them in early.
Yeah.
Yeah.
Well, we're trying. We're trying. All right, so we're gonna wrap because I know you have a child nursery pickup, and I don't want you to be late. I was always the late mother. I was late on delivery, and I was late on pickup because I just have no time, which I'm already getting yelled at. But so again, we talk a lot about the category of one. The
Right.
podcast is called Category of One. So talk to me real quickly about what that means for you.
Do you want to go first?
Sure. I mean, always delivering the category of one experience is hopefully making a patient feel like they're more than just an appointment on your schedule. You want them to feel heard and feel comfortable in your chair and feel like you're their dentist and not just a dentist that they're seeing.
Yeah, I love that.
I agree with all that. I would say every patient, whether they show it or not, they just, they don't want to be judged. They don't want to be hurt, right? They want to, if we're recommending something, it's crazy how big of a difference it makes when I actually, show them an intraoral image or show them an x-ray and actually talk them through what this is, why it looks this way, what's happening, what's going to happen. I would say most of the time when I do that, they're like, why has no dentist ever, they would tell me they didn't work, but they would never explain, what's even going on, right? So I think that is a big part in providing that experience is taking the time to educate them and just making sure they're completely comfortable the entire way. Because a lot of times when you don't understand something, that's when patients will tend to shy away and either not come back, not seek treatment. A lot of times patients are just, they feel ashamed when it really shouldn't be. But I'd say I'm surprised how many times patients come in and they'll say, "Oh, this is gonna be the worst mouth you've seen all day." Almost every day I have a patient come in and say that.
I mean, that's really amazing to me in
Yeah,
this
and
day
then
and
every
age.
time,
But
yeah.
that goes to how I started the podcast, where I do think that 20% of the population really understands that dental is part of overall wellness for their body. Yeah. Well, I think you guys both embody the category of one. I'm happy we spent a large chunk of the time talking about your personal story, because I think even in that space, it's a category of one. And I think that you guys have parented like that. It seems like you show up for your families like that and in your friendships. And I'm glad that you're able to take who you are and deliver it holistically to our patients and also the team, because when you are like that and you take the time with the patient, you're imprinting that on your dental assistants and on your patient coordinators, where unknowingly you're letting them know that it's safe to be like that, to follow your example and elevate how they show up and interact with a patient. So I love it. I appreciate you guys coming in on a Friday
Of course.
and
Thank you for having
Yeah,
us.
on your couple's day off. That's so nice. So nice. All right. Well, thank you again.
Thank you,
Thank you,
Jen.
thank you.
Thank you.